Anorexia and bulimia can be really confusing. While both of the eating disorders have a lot of things in common, anorexia is more often on teens, while bulimia is more often on women under 20. However, there's no set of age for the eating disorder.
Anorexia is an eating disorder characterized by markedly reduced appetite or total hatred towards food. Anorexia is a serious psychological disorder. It is a condition that goes well beyond the controlled dieting. The person with anorexia, most often a girl or a young woman, initially begins dieting to lose weight. The individual continues an endless cycle of restrictive eating, often to a point close to starvation. This becomes an obsession and is similar to an addiction to a drug. Anorexia can be life-threatening. About 9 out of 10 people with anorexia are female, but some of the males have it too. Anorexia affects less than 1% of the population. The cause of anorexia is usually a poor self-image and a low self-esteem. It may also be caused by the need to be thin for an activity such as sports or modeling. The causes of anorexia are dealing with stressful events such as divorce, moving to a new town or school, or even losing a loved one. People with anorexia often deny they have a problem. They do not see or believe that they do. It is often left to their loved ones to get help for them. Some of the symptoms are having thin hair, dry skin, stop having menstrual periods, have swollen feet, have low blood pressure, and slow heartbeats.
Bulimia is a psychological eating disorder. It's characterized by episodes of binge eating followed by inappropriate methods of weight control. Inappropriate methods of weight control include vomiting and compulsive exercising. Excessive shape and weight concerns are also characteristics of bulimia. A binge is an episode where an individual eats a much larger amount of food than most people would in a similar situation. It is usually a response to stress, depression, and self-esteem issues. People with bulimia may look perfectly normal. Most of them are of normal weight and some are overweight. It is often difficult to determine whether a person is suffering from bulimia. This occurs because binging and purging is often done in secret. Sufferers consume huge quantities of food. Causes of bulimia. There is currently no definite known cause of bulimia. Researchers believe it begins with dissatisfaction of the person's body and extreme concern with body size and shape. Usually, individuals suffering from bulimia have low self-esteem, feelings of helplessness, and a fear of becoming fat. Symptoms of bulimia are eating uncontrollably, strict dieting, rigorous exercise, vomiting or abusing laxatives, vomiting blood, depression of mood swings, feeling out of control, weakness, exhaustion, bloodshot eyes.
Both disorders have health issues, while bulimia damages the organs and anorexia makes your body slow down. Now here are more health issues of bulimia and anorexia.
Anorexia could cause reduction of bone density, cessation of menstrual periods, fatigue, depression, irregular heart rate failure, mild anemia, muscle loss, possible kidney failure due to dehydration, low blood pressure. Bulimia could cause possible rupture of the esophagus due to frequent vomiting, fatigue, depression, stomach pain, irregular heart rate leading to possible heart failure, constipation, tooth decay from stomach acid.
we're going to introduce you to the case of Carol. Carol Isabelle was a French model who appeared in the No Anorexia campaign.
This picture shows the model with facial bones under her skin. This picture was photographed by Olivero.
Carol suffered from anorexia since the age of 13. Her anorexia was caused by what she calls a troubled child.
When she appeared on the CBS The Insider, it revealed that her eating disorder was really bad and that she only weighed 25 kilograms.
She appeared on Channel 4, Super Size vs. Super Skinny, which aired on March 11, 2008. She also spoke to journalist Anna about her anorexia.
Carol was also interviewed in the second episode of the TV document series The Price of Beauty, in which Jessica Simpson and her two best friends were in.
Carol died on November 17 of 2010 in France, after spending about 2 weeks in the hospital with the disease.
The cause of her death is unknown. There has also been said that Miss Carol has died after returning to France in a job in Tokyo.
Her family only reported Carol's death to the media a month afterwards on December 29, 2010. Unfortunately, there are many causes like Isabella Carol's case.
Also, 86% of people with eating disorders report the illness by the time they're age 20. The death rate of eating disorders is about 20%. Also, about 80% of women want to lose weight. That leads us to our next topic.
Eating disorder affects millions of teens and young women and are more common in cultures that focus on weight loss and body image. Weight loss can lead to negative body image and unhealthy eating behavior, which eventually leads to anorexia and bulimia.
The phrase body image means the thought and feeling people have about their physical appearance.
Eating disorders can affect a person's physical and emotional health. It can be very dangerous, and if not treated, it can be very fatal.
So what are some ways that people with anorexia or bulimia could get help?
Really, there's people that specialize in treating those disorders. It usually has to do with doing individual counseling with them. I'm not specialized in treating those disorders. I have worked with students who have eating disorders, but I don't have that specialty, so I usually refer to outside professionals that specialize in that. And there's also medication sometimes that people can take to help with dealing with some of the feelings that are causing the anorexia and bulimia.
What are the ages of the students that you usually see that have this symptom?
Usually around high school age, I would say, probably anywhere from 14 to 17, but I have worked with students as young as like 9 or 10, actually. That's pretty rare, but more common in the high school years.
Is it, you see it more often in girls than boys?
Generally, yes. Yeah. Eating disorders, especially anorexia and bulimia, are more common in females, but there are boys that suffer from it as well.
Now we will be introducing you to the story of Judy Sargent.
Judy is 42 years old, and she suffered from anorexia 10 years. Now she is a survivor from anorexia, and she was hospitalized over 26 times.
Judy has written a book which is called The Long Road Back, A Survivor's Guide of Anorexia.
This book explains her survivor guide with the hope that it will offer individuals currently suffering from an eating disorder, family members, friends, and therapists insight, compassionate understanding, and hope.
Judy also said her book provided a hopeful and uplifting journey through the recovery process. She also mentioned an eating disorder program in California that helped her a lot with her eating disorder by
The Medical Therapy Core, the Lifestyle Core, the Complementary Medicine Core, the Environmental Core.
Now Judy is working on completing her doctorate in nursing from a major university and says her life is finally balanced.